And once again, welcome to my Oet channel. Today's video, we will just discuss regarding the role play cards. In most of the cards, you may find out the term confirm. In the starting task itself, it can be seen like a confirm reason for patient's visit. In bracket, they have given for what purpose they came to hospital. Then there will be some subtask will be there. Example, in this case, role play card, you can see that the first task itself they have given confirm reason for patient's visit. In bracket, they have given ECG or electrocardiogram. Then find out how patient is feeling now and whether he or she has had ECG test before. So in such scenario, how we can start the introduction. So before going further, just we can see the settings. You are a 50-year-old patient who has been referred for an ECG because of chest pain. You explain the procedure to him or her before beginning. So this is the scenario, and this patient actually came for ECG. But before proceeding the procedure, you want to explain some more details about the procedure to the patient. So this is the scenario, and how we can start the introduction. So just we can self-introduce. Good morning. My name is Rashmi Rajan, one of the restored nurses working in this community health center. For our better communication, may I know your complete name? Then patient may tell that my name is George Thomas. Then we can tell that, well, Mr. George Thomas, from my system, I can tell you that you are here for ECG procedure. Am I right? Or am I correct? Or isn't it? That's all. So that is the starting introduction for this type of case note. So whenever you will get the term confirm in role play task, that means it is nothing but you are just confirming with the patient about the procedure or about the incident or about the thing, especially it will be there in the starting area of your role play card. So I hope it is clear for you. So in this type of questions we can see in many of the cards, in that time at that time at every time whenever you will get such cards, just remember that don't ask in the normal way, could you please tell me what brings you here, or what is the thing I have to explain you. Nothing like that. Just you have to make it the make the may make I mean get the answer from the patient by asking the answer, by asking the question. It's like with the answer. Okay. In this question paper also, you can see the same scenario they have given. It is a suburban clinic and you see a 62-year-old patient who has rheumatoid arthritis. He or she is attending an appointment to get information about a pneumococcal polysaccharide vaccine (PPV), which he or she has been advised to have. So the first task is confirm the reason for the patient's visit. So how we can start? Good morning. My name is Rashmi Rajan, one of the registered nurses working in this suburban clinic. For our better communication, may I know your complete name? Then maybe patients telling that my name is Tom. Then we can tell Mr. Tom, from my system I can confirm that, or I can tell you that you are here for for the vaccination against pneumococcal polysaccharide. You are here to receive pneumococcal polysaccharide vaccination or PPV vaccination, isn't it? So in that way we can ask the patient. Another one scenario. Here in this card, you can see the setting is community health center, and the scenario is you see a 66-year-old patient who is concerned about the varicose veins on his or her left leg, which have become increasingly itchy. He or she would like some advice. You have just examined his or her leg. So in this scenario, we could not tell the we could not self introduce ourselves, and we could not ask their name, and we could not state anything as in the previous way, because this is a non scenario. You can see you have just examined his or her leg. That means you have already started the conversation and you are in the middle of the conversation, because you have already examined the patient's leg. So here in this first task, what they have given, confirm inflammation of varicose veins, find out relevant patient details like general health, underlying health conditions, etc. So in this case, it will be different. What you can do during 3 minutes preparation time, you can ask the interlocutor how may I address you. Example: the patient's name is John. Here already you have examined. So how we can start? Well, Mr. John, thank you for allowing me to examine your affected leg. And upon my assessment, I can confirm that you have inflammation of your varicose veins. So that is a confirmation. That means after your assessment, what is the result of your assessment? That is the thing you are stating. And this role play and the previous role plays are totally different. And and you have another one scenario. It is a hospital accident and emergency department. You are a 40-year-old patient who has come to the emergency department with a burn on his or her foot caused by dropping an iron on it while ironing this morning. You have just examined. So in this scenario also the same word you have just examined. So this is a cause. This is a known case. While assessing the patient in triage before he or she see a doctor, you confirm it's a superficial thermal burn. So this one also no need for self-introduction. You can just start. Mr. John, thank you for allowing me to examine your leg, and from my assessment I can confirm that there are the presence of blisters and a few white patches over your leg part. It is nothing but superficial dermal burn. So that is the introduction for this role. You can see that this is a clinic and your patient is 51 years old and has had a lesion removed from his or her hand following a diagnosis of squamous cell carcinoma, and he or she was overexposed to the sun in his or her teens. You have come to remove the stitches. So in this one, the first task is confirm the reason for the visit, removal of stitches, wound dressing and cleaning, and find out the patient has any other concern. So in this case, we can just, this is a clinic and it's same like OPD. So here, as I told you earlier, you can start like with the self-introduction. And you can tell that, good morning, my name is Rishmi Rajan, one of the registered nurses working in this clinic. May I know your complete name for identification purpose? Then example, patient name is Williams. Again, we can tell that from my system I can confirm you that, or I can state you that you came here for your removal of stitches, wound cleaning and redressing, isn't it? So that is the introduction of this role play. The next card is somewhat different card. You can see that it is a hospital ward, and you see the parent of 7-year-old girl who has just had her adenoids removed and is due for discharge. You see the parent to discuss his or her daughter's discharge and to answer the parents' questions. His or her daughter is not present. The first task is confirm the doctor's readiness for discharge. Post-operative recovery satisfactory, and find out if the parent has any concern like pain management and self-care after discharge. So this is somewhat different scenario because it is a hospitalized background, and this is, we can take it's like a non-case also because we are familiar with the patient and mother. So here we can start. Example, during the 3 minutes preparation time, you have to ask interlocutor the parent's name. Example, her name is Maria. You can tell, good morning Maria, how are you feeling? So this is like second degree to conversation. You are talking to patient's mother. So you can tell that, good morning Maria, how is your baby doing? You can ask, how is your baby doing? Actually, I came here to discuss regarding your baby's discharge process. If I am not wrong, you are aware about your baby's discharge, isn't it? So that is a confirmation. You are confirming that the baby is getting discharged today. So this is something different role play card. So I hope it's clear for you. This concept can be appeared in exam in different way. Same as I told you, can be in the emergency department, in the hospital ward, mostly in the clinics. So according to the scenario, whether it is known case or unknown case, also you have to see. According to the scenario, just formulate the questions, but at the end of the question, it should be like we are asking the question or we are confirming with them, isn't it? Is it correct? Am I correct? Like that. So in that way, you can present the term confirm. So I hope it is clear for you. We will see with another one informative video. Until then, bye. Take care.